Hello, my name is Dot Weir. I've been a wound care nurse for over 4 decades in the United States, and I practice in Saratoga Springs, New York. I appreciate you spending a little time with me today as we talk about exudate management. I do want to let you know that I am a speaker and a consultant for Mölnlycke Health Care. We all face similar challenges with our patients with draining wounds. First and foremost are the quality of life issues that the patient faces with the odor, the appearance of the exudate, and the embarrassment that both of those bring. The potential soiling of their clothing, of their bed linens, and the potential loss of work days, either because they can't work with the lower extremity dressings or because they have to take time off from work to go see their healthcare providers. The skin issues with maceration at the very least, but oftentimes erosion of the skin, which causes pain for the patient, and the potential secondary infections that may occur, as well as local colonization of the peri-wound skin. So all of this adds up to an increased cost of care because of the frequency, the number of dressings that patients are using, as well as the potential issues with access to care. We had the opportunity to evaluate a new dressing by Mölnlycke Health Care called Mepilex Up. It's a borderless foam dressing that has a unique dimpled structure, dimpled pattern in the dressing that enables the exudate to spread outward into the dressing evenly and actually help to counteract gravity when used on lower extremity ulcers, especially under compression. So it helps to minimize that risk of leakage as well as meet several needs, with the main needs being the need for uniform absorption and under compression without the erosion and the maceration. So this was one of our early patients that we evaluated it on. This was a young lady who has bilateral lower extremity ulcers, and this is her left leg. So you can see the size of that wound. And she was coming in twice a week to the clinic for her wrap changes and dressing changes. And she almost always had strike through just in those few days. So this was the appearance of the Mepilex Up on her first visit back to the clinic. You can see it has spread the exudate out into the dressing. And then the far right picture is the underneath side of that same dressing, showing that there's not a lot of pooling of the exudate against the dressing. So this is after treating her for 3 months. You can see the remarkable improvement in the appearance of her wound. This is another gentleman that we evaluated it on, a 60-year-old fellow who's a car engine mechanic, so he's on his feet all day long. He had known venous disease and had already gone through several procedures to try to treat that venous insufficiency. So this was his initial presentation to our clinic. And this is after a couple of weeks with an antimicrobial foam, a super absorbent dressing, and utilizing 2-layer wraps. Well, then he became infected. So we started him on doxycycline. We were using cadaxamar iodine, and then we put Mepilex Up over that. So this is 5 days later, marked improvement in his leg, but we were out of Mepilex Up, so he had to reorder some more. So then he comes back in another 5 days, and as you can see, his exudates have built up again on the surface of this wound, although it didn't look infected anymore. So we reapplied Mepilex Up. You can see just 1 week later, he was coming in weekly for his wrap changes. And then after about 3 months, you can see significant improvement in his leg ulcer. This was another woman that we know very well from previous wounds, and she's 73 years old, but she had been in a motor vehicle accident. You can see her past medical history and the things that it includes. She is pretty much wheelchair bound because of spinal stenosis, and she has not only dependent edema, but edema from her venous insufficiency. Unfortunately, she was unable to tolerate adequate compression, but you can see that we had some work to do on this wound. So this is after 4 months. We had gotten the wound debrided, a little more under control. And so now this is when we started Mepilex Up. Now her venous insufficiency has taken over, become the biggest problem. But again, as I mentioned, we are not able to use really good tight compression on her. So we did use Tubi Grip for edema management and began the Mepilex Up. And you can see this is her bilateral legs and the injuries that now have become venous ulcers. So this is after 7 days. You can see an improvement in the ulcers. Part of them have already started healing. She went from 135 square centimeters down to 127, and you can see the one on the other leg is also improved. This is at day 28. She is exquisitely happy, not only because it's more comfortable for her, but again, she didn't have the issues that she had been dealing with the Exudate management. And then this is at day 62. She's down significantly smaller in both of her wounds, and she continues on. And then lastly, this is a patient who has a venous ulcer. She started as a boot rub, a rub from a boot that she had on, and it had been present for a couple of months. So we started her on collagenase to help clean it up and some Mepilex border flex and put her into a 2-layer wrap. So she was doing well, but she still was having some issues with erosion just around the peri-wound area. And so we did change her over to Mepilex Up, and you can see in just a month's time that she vastly improved, and then she did go on to completely close. So in summary, I would say to you that things are looking up. Mepilex Up provides exceptional exudate management, especially under compression, helping to counteract the gravity and drainage that occurs from gravity underneath the wraps. It helps to manage leakage, manage skin issues, and certainly helps us to reduce the frequency of our leg ulcer wraps because of the improvement in the ability for it to handle the exudate. Unquestionably, we also see a much improved quality of life on behalf of the patient. So I hope this gives you some insight into how Mepilex Up works and what it can bring to your patients. I appreciate you spending some time with me. My name is Dot Weir.